Hello, as promised, this is the second segment of our discussion about specialization in nursing. There are so many areas that you could consider specializing in if you have not specialized yet. Now, the first area that I'm going to talk about is nurse-lawyer specialization. There are so many nurses now who are considering to have legal knowledge. Like an example of where I work, I've got two colleagues who are nurse lawyers, and there are so many benefits for you to consider. If you are already qualified as a nurse, you can as well have a second degree in legal matters or in law. Some of the benefits that I have had with the colleagues who have done law, they explain to me about the scope. Oftentimes you find nurses, we do so much which is even outside your scope. But with the legal minds around, they give you the scope within which you're working. They also teach us about medical legal matters, which include consent, how to obtain an informed consent, how to work within the consent limits. For example, if I can give an example, like if you are in an operating room and maybe a patient has been brought in for debridement, and then intra-op it's discovered that the patient needs to have an amputation. As a nurse, would you continue? Would you go on to have that patient's limb amputated? No. If there was no informed consent, if the patient had not consented for that, then you only do your debridement, have the patient go back to the ward and obtain the consent for amputation. So as you can see, the legal minds help us so much to understand how the law works. Another aspect that they bring about is about proper documentation. You need to do your documentation very, very well. The documentation has to be legible, and also make sure that you own that documentation. Sign your name and ensure that it is clear what you did and also within the timeline. So indicate that whatever procedure that you've done, you have done it properly, and document and sign and own the document. There are so many areas that the lawyers have been able to help us. So you can consider being a nurse lawyer. The second specialty that I'm going to talk about is perioperative nursing. Perioperative nurses do a very good job in care of the patient around the time of operation. They are very sharp nurses, skilled nurses in taking care of the patient pre-operative. They do pre-visits in the ward to create rapport with the patients. They allay anxiety and come to the theater and also prepare for these patients and take care of them during operation and immediately after operation in the post-anesthesia care unit. That is about perioperative nursing. And as you well know, operations usually happen in the operating room. So as a perioperative nurse, you are going to be working in the operating room. Now, for the perioperative nurse, as I was saying, you will need that you are going to be working in the main theaters or in the daycare centers. In the daycare center, operating centers, you realize that you'll be doing such operations where the patient comes in, gets operated on, and will go back home. Some of the procedures that you may be doing there are like excision of lipomas, excision of ingrowth, toenails, such procedures which are not major, what we call minor surgeries. Now those are done in the daycare centers. And for as a perioperative nurse, you might even continue to do sub-niching. That is specialization. Yes, you are a periop nurse, but you can do something like, so you can specialize like in laparoscopic nursing, whereby you are going to be handling the laparoscopic operations, where you know how to take care of the camera, the monitor, the insufflators, among other things. And also you can decide to become a cardiothoracic a cardiothoracic nurse, where you are going to learn more about care of patients that are being done open hearts, open heart surgeries, chest surgeries, and even vascular surgeries. So as you can see, peri-op is wide. Once one gets into the peri-op nursing, there is a whole lot of specialties or subspecialties that one can take up. The third specialty nursing I'm talking about is nurse anesthesia. You can become a nurse anesthetist. So once you have done your first or your primary nursing certificate, that's a registered nursing, you can now, or your degree in nursing, you can now, after working for 2 years, you can go in and specialize in taking care of patients, giving patients anesthesia and taking care of them during surgery and after surgery. So it's called nurse anesthesia course, and it's also a very good specialty where your experience, your primary experience as a nurse, greatly helps you in the care of these patients that are undergoing anesthesia. So nurse anesthesia is another, and we have it, if you are in Kenya, we already have it in a place like Kijabe. Kijabe Hospital does have the nurse anesthesia course. Now, the third specialty I'm talking about is nephrology nursing. In nephrology nursing, if you like taking care of patients like those ones who are undergoing dialysis, patients with urological conditions, then this is an area that you will enjoy working. And it may interest you to know that some of the nurses that come to train, they tell me that their motivation, the reason why they are coming to do the nephrology nursing, is because there was some equipment that were bought and they were lying idle in the counties. So the nurses, came up with the idea, let us go train in the dialysis nursing to come and utilize this equipment. That is also another motivation for a nurse or for someone to come in or to go in and do nephrology nursing. It's also a very good skill where you can even start your own dialysis center. You can come up together as a group, you can even start your own dialysis center. There are so many opportunities. So you can work in hospitals where they have dialysis centers, or you can even have your own dialysis center. The fourth one is oncology nursing. We find that if you like working with patients that have cancer ailments, and you want to take care of them, you are compassionate about them, this is one area. And as you know, right now we are having a rise in the number of cancer patients or cancer cases worldwide. And we are short of oncology nurses that will be able to take care of these patients, give them health education about their diet, give them health education about the management of their condition, about the medication that they are getting. So as an oncology nurse, there is so much that you can also be able to do. Now, you can specialize in this oncology nursing, and if you don't want to become an oncology nurse, or maybe if oncology nursing is not what your specialty, then you can think of trauma and emergency. In trauma and emergency nursing, you are going to handle patients that have been injured, like RTA patients, road traffic accident patients who have been involved in road traffic or other emergencies. And you will be very well versed with the skills. You can even work with the ambulance services because you know how to handle the equipment and how to stabilize patients who have been injured, or trauma patients. As you can see, there are so many specialties that you can take up. It is up to you to choose, and do not take long. Once you have chosen that this is your field, specialize then, because it will give you a focus about what you need to do. You will understand your equipment better. In our next segment, I'm going to continue to talk about the other specialties that are available for you to choose from, so that you can hone on one of your specialties and run with it. If you have not subscribed, please go ahead and subscribe and hit the notification bell, and also share with your colleagues, because information shared is good. It is going to help us make our world a better place. See you in the next one.